Across Uganda, it is impossible to find a government-run health center at the different levels from 2, 3 and 4 operating with 100% staff capacity. Although some districts might have moderately fair staffing levels, like Isoro at around 70%, the situation in other areas like Karamoja sub-region and Chibale is worse. Many public health centers there are making do with barely 50% staffing levels. Surprisingly, even urban districts like Mbarara have understaffed health facilities.
Mbarara is the least staffed in southwestern region, Mbarara district, at about 49% staffing level. And Kabale Regional Referral Hospital is also chronically poorly staffed for whatever reason. I mean, it's a beautiful place, it is an urban center, but for some reason you find it's understaffed.
The Chief of Party of IntraHealth Uganda, Dr. Vincent Okecho, says in tackling the challenges of human resources in health and revamping the health sector in general, the leadership should play a critical role. The leadership should play.
And we all know if you have a weak leader or an absentee leader for that matter, then people will come knowing that in any case he will not be there, they will come late. Or they will not come at all, so they choose to do things the way they want. That's one major thing.
He explains that motivating the human resource would be a good starting point.
The second one, of course, is people would blame it on low pay. So many health workers, particularly the senior ones, would want to have several workplaces.
He also recommends that strengthening the performance systems of health workers in the districts is also vital. To tackle rampant absenteeism, the advocates for better health believe that besides regularly monitoring attendance, biometric systems should be put in place to track the attendance of health workers.
The biggest challenge that people have is to wake up early, go to a health facility, and they sit from 6 a.m. in the morning to 12 p.m. and nobody has shown up. They have not seen a medical worker. The presence of a medical worker speaks confidence into the life of a patient.
Lack of accommodation for health workers near the health facilities is another serious challenge because emergencies cannot be adequately handled since many live far away from the health centers they work for.
Biggest challenge, lack of staff quarters. Another one, stockouts. We are having patients, but you don't have what you are going to use to care for them.
Civil society organizations intensified the advocacy for better health services in 2009 with the hope that the situation could change for the better. And much as there have been some strides in this direction, like the renovation and expansion of some hospitals and health centers, there's still a lot that needs to be done, especially regarding to staffing levels in public health facilities. Suhail Mugabi, NTV.